Hello, welcome. Today we're going to discuss a condition called Hypoplastic Left Heart Syndrome. Here we have a virtual auditorium which we've made to help us to present the videos, and this is Ed the avatar who will help me to describe the different conditions. Now before I start, I would like to remind you that this video is for general information only. Please don't use it as a source of specific information about the care of your individual child. I'm sure you will discuss any specific questions about your special child with your healthcare provider. So let's start. First, it's probably useful to consider what happens in the normal circulation, and so you may want a brief refresher course on this from our video in this series about the healthy heart. So briefly, the normal heart has two separate sides. The right side of the heart collects blood which is low in oxygen coming back from the body and pumps this blood through a big artery called the pulmonary artery. This then transports the blood to the lungs where it picks up oxygen. The left side of the heart receives oxygenated blood coming back from the lungs and pumps this blood into a large blood vessel called the aorta, through which the oxygenated blood is then distributed back around the body. What's important for the circulation to work normally is that there are 4 good-sized chambers, that all the valves in the heart work normally, and that the aorta and the pulmonary artery are of normal caliber. So in hypoplastic left heart syndrome, the left side of the heart is very underdeveloped. The mitral valve is often tiny and may be completely obstructed. The left ventricle is very small. The aortic valve is tiny and may be completely closed over. The aorta is very small and may be obstructed. So as we think about that, let's now look at the circulation of blood in a patient with hypoplastic left heart syndrome. The blood, which is low in oxygen, comes back from the body and enters the right side of the heart. It's then pumped out of the right side of the heart into the pulmonary arteries so that, as usual, it can pick up oxygen in the lungs. So far, so good. But now look what happens to the blood as it returns from the lungs. It enters the left atrium, but it cannot cross the mitral valve. The only way out of the left atrium in most patients with this condition is across a hole in the atrial septum. This is called an atrial septal defect. And then after arriving in the right atrium, it crosses the tricuspid valve into the right ventricle and onwards to the pulmonary artery. So how does the blood get to the aorta and back around the body therefore? Well, there is a communication. We call it the ductus arteriosus or arterial duct that connects the pulmonary artery and the aorta. And so some of the blood coming into the pulmonary artery then crosses the duct and circulates around the body to supply it with oxygen and other nutrients. One thing about hypoplastic left heart syndrome is that we can often detect this condition on an ultrasound exam before the baby's even born. And this allows us to transfer mom and baby together before baby is born to a maternity hospital near a pediatric heart center. And what this then allows us to do is that we can act immediately if a baby deteriorates shortly after birth. And sometimes, in very high-risk babies, certain specialist centers can often do life-saving procedures even before the baby is born. So when a baby is born with hypoplastic left heart syndrome, your child's medical team will be looking out to make sure that the atrial septal defect is large enough to allow blood to leave the left atrium and go to the right atrium. And they will also put your baby on a medication called prostaglandin. This medication keeps the ductus arteriosus open to allow blood flow around your baby's body. And then your medical team will often allow your baby a period of stabilization before performing the first stage of the surgical program. So most children with hypoplastic left heart syndrome require a series of procedures. In this video, we will only describe the first. The other stages, called the bidirectional Glenn operation or bidirectional cavopulmonary shunt, and the Fontan procedure will be described in other videos in this series. And so the most common type of procedure performed in newborn babies with hypoplastic left heart syndrome is often called the Norwood procedure, or sometimes it's called stage 1 palliation. Now, this is a major form of heart surgery. During the procedure, the surgeon will open up the atrial septum and will use the pulmonary outflow to replace the function of the aortic valve, and they will reconstruct the aorta. And now the surgeon needs to make sure that there is a way of getting blood into the pulmonary arteries to supply the lungs. And she can do this in one of two ways, either by directing blood from the reconstructed aorta to the pulmonary arteries through a shunt, or she may place a tube from the right ventricle to the pulmonary arteries. Sometimes this is called a Sano modification. Now, in some centres and in some children, the team may prefer to use a different approach to first stage palliation. This is called a hybrid procedure, and it involves a very close collaboration between the cardiac surgeon and the interventional cardiologist. Now, here a stent is placed across the arterial duct, and bands are placed across the pulmonary arteries to restrict blood flow to the lungs. The atrial septum is then opened in the cardiac catheterization laboratory. Which approach is better? Well, this is something that needs to be discussed with your child's treating team. What's best can vary between centres and can vary from patient to patient. So please discuss the options with your team. Irrespective of the precise type of procedure performed, all patients will need to stay in the intensive care unit afterwards while they recover, and they will be monitored closely, initially as an inpatient or hopefully subsequently as an outpatient, until their next procedure at a few months of age. And finally, in some patients, cardiac transplantation might be considered to be the best option. We know that this condition places an enormous burden on families and really pushes the boundaries of medical and surgical care. But our outcomes have really improved dramatically over the past couple of decades. Many of our patients are now attending school, attending college, and even having families of their own. We hope this for your baby. We hope that you found this video informative, and thank you for your attention.